So Haley and I are doing our presentation on chapter 12, which is the engaged e-patient. And we've broken it up in lessons to hopefully allow you all to better understand the information and kind of break it down, because I know when people have done that, it's really helped me. So I'm doing lesson 1, which is the historical background and drivers of the e-patient evolution. So to begin, I'm just going to start off kind of like a history, how it came about and stuff. So in 1975, Thomas Ferguson was a pioneering physician who described the term e-patient as people who are equipped, engaged, enabled, empowered in their decisions about their health and their health care. So today we understand e-patient as people who use technology to partake in their own health care and manage the responsibility for their own health and their own wellness. As you all know, technology is a big part of almost everyone's lives in the United States. So being able to use this technology to better your health and really help your health care is a great advantage. So e-patients can participate and follow along in their health journey and can keep up to date with their health information. So say you're at a doctor's appointment and you sign up for patient portals or something along the lines where you go on some type of technology to look up your labs or your results or anything. This would be a person who's considered an e-patient because they're using technology for their benefit and to look up their health information. So on our PowerPoint, I did a slide on the use of the internet throughout the years, and I thought this was crazy. So in 1995, there were 16 million internet users, and I think that's a lot, but as you will see as these statistics, they rise very dramatically. So in 1998, 147 million internet users. Then in 2001, there was 500 million internet users. 2015, over 3 billion internet users. And then this one blew my mind. In 2021, there's an estimated 6.3 billion internet users. So with all these people using the internet, it's very, like, their healthcare, you can access it so much easier. And so, yeah. So these statistics show that the internet can be valuable for your healthcare. So, yeah. And then on the PowerPoint I included a picture of the digital snapshots, like digital around the world. So in our book, it gave us a digital around the world picture from 2015. So I went to the website that the book cited and found a more up-to-date picture from 2019 because the book gave us one from 2015. So this just shows our total population, how many people have mobile devices, how many internet users we have as of 2019, how many people use social media, and these numbers are crazy high. So I highly suggest to look at the PowerPoint and check out this picture because it was an eye-opener for me, that is for sure. So when the internet came out, so did Google after a few years. So in 1998, Google was created, which allowed people to search online for information related to their health. I know when I get sick or one of my family members gets sick, Google is the first place I go to type in my signs and symptoms and see what is this, how do I treat it, and that kind of information. So e-patients, people who are using technology for their healthcare, health, to find information. These people start looking up their signs and symptoms, conditions, and treatments, which created the new generation of ePatients. So I know Google can be sometimes not a benefit because it might give you a little dramatic answers and you'll start freaking out, but overall Google is a pretty good use of, okay, this is what my symptoms are, and this might be a good way to fix it. Yeah. So, okay, moving forward. The Institute of Medicine, IOM, they issued a report that stated healthcare should be safe, effective, patient-centered, timely, efficient, and equitable. So this is, just an overall kind of idea of how healthcare should be, which is, I agree. So in 1999, the term e-health emerged, which describes electronic communication and information technology related to health information that is accessible online. So this is kind of like ePatient, but it's a more general e-health definition. As you all know, healthcare can be expensive, so the uninsured and the underinsured are avoiding expensive services like going to the doctor's office, going to the ER. They're using technology such as, the internet to manage their own health care. So they're getting to avoid these expensive services and manage their own health care because they're e-patients. They're chatting online with other people who have the same issues, or they're looking up what's the best remedy to cure cold, or they're saving a trip to the doctor's office by trying to find out if they can fix or treat their own condition. And so, as I've said before, ePatients now have access to data and resources more than ever before. An example of that, the book gave that 23andMe is now available to people who want to know their genetic information, genetic makeup. And it took so long for researchers and scientists to find out how to do this, and now we get the opportunity to learn our genetics just from 23andMe, which is so simple. They send you the box, and then you put your saliva in there as your DNA sample, and then they send you something you connect with on the internet that tells you all about your genetic information, and it's pretty cool. I have done it, and I was quite surprised, and it was really cool, honestly. So that's another way that how ePatients are getting to connect to their own health and stuff like that. So mobile technology is rapidly emerging, and ePatients are taking advantages of their resources. So in a report titled Health ePeople, the Online Consumer Experience, researchers introduced 3 categories of digital healthcare consumers. They did a study to see what each healthcare consumer was searching and what they're more likely to search. And they came up with 3 categories. The well, the newly diagnosed with an illness, and those who are chronically ill. So what research showed was that the well were searching, their search was related to more of wellness and prevention. So they were searching how to prevent diseases, how to get in shape, how to be healthy, how to exercise, and good nutrition and stuff like that. And then the chronically ill, they searched for sites with resources, services, and sites that supported their specific condition. They also searched for people to communicate who have similar conditions, so online chats with people struggling with the same illness, or somewhere where they can talk about their feelings and know that they are understood and people get what they're saying because they're going through the same thing, which can be very beneficial because just to know like you're not alone through the illness. And then those who are newly diagnosed with an illness, their searches were driven by a sense of urgency to understand, manage, and mitigate a recent change in their health status. So they were searching for more of what is their illness, how to treat it, what medications they take for their illness, can their illness be cured, and stuff like that. So this report showed 3 categories: those who are well, those who are newly diagnosed with an illness, and those who are chronically ill. And the study also went on to talk about the caregivers and said that the caregiver searches were related to more of like coping for them and coping for whoever they're caregiving for, and for people to talk to who are also caregivers who are going through the same struggles they are. I remember for last year we had our clinical at the Alps, and it was kind of similar. Caregivers just opening up, sharing their experiences, trying to talk through it. But this was more, in this sense, it's more online. Chatting with people who knows what you're going through and understands and can really be there for you, and a support system. The report also broke down contemporary patients versus active patients, and they were saying that contemporary patients are more of like the information seekers and data gatherers, and they take responsibility for their health. They search online and also offline to find the most resources, the most accurate information that's going to help them out, prevent illness, and keep them on track. And they related the contemporary patients, to the category those who are well. And then the report also said that they talked about active patients, and those patients are more interested in tracking their own health by using devices such as now Apple Watch does it. They keep journals, they have Fitbit, something that tracks their health information. And so they use their self-managing tools, and that relates to more of the newly diagnosed with an illness and the those who are chronically ill. And so back to the tracking devices. A lot of the well patients as well use the tracking devices, but this is where they categorized it at. The textbook gives a good example of a contemporary patient. So it gives a cool story of a man who was diagnosed with stage 4 renal cell carcinoma, and the doctors gave him 24 weeks to live, and he decided that was not long enough, so he started to search for effective treatments, clinical trials that were effective. He started talking to patients who were going through similar challenges, and he eventually started talking to patients on the Association of Cancer online resources. And this is where he found people who went through a clinical trial. So he started researching the clinical trial more and found the do's and the don'ts, how to get accepted into this clinical trial. He started talking to his doctor about it, and he eventually was accepted into this clinical trial. And the textbook states that he actually survived this renal cell carcinoma that had spread to his muscle bones and lungs. He survived it all because he started getting educated about his cancer. He started researching it, and I thought that was a really good example of an e-patient, being engaged in your medical treatment and actively working on finding cures. I know that's not how a lot of the stories go, but this was a great example of like you can make a difference in your own health. And so now I'm going to talk about a definition that the book highlighted and really went into depth about, and it is quantified self. So quantified self refers to a person invested in using tools and data to quantify and monitor daily experiences using personal metrics. So they can measure, food consumption, physical performance, stuff that tracks their health. And an advantage of this is they have the potential to identify health changes more quickly. So, and the book was also saying that these people don't really identify with e-patients. They identify more as they're just keeping up with their health, trying to stay healthy, and focusing on staying in shape and getting the right nutrition and drinking enough water and so on. So the book also talks about they can wear real-time feedback sensors that they wear. So I picture that as like Fitbits, Apple Watches, Garmin, stuff like that. And it'll give you your baseline, and then like these types of technology can tell you your heart rate. It'll give you reminders if you're sitting down too long. Okay, so that was all basically lesson 1 for chapter 12. So now I'm just going to kind of go back through and give a little overview, a recap of everything we talked about. So ePatient, that term came about by Thomas Ferguson in 1975, and he described as people who are equipped, enabled, empowered, and engaged in their medical decisions and decisions about their health and healthcare. Today, the ePatient term has changed just a little bit, but not really. And it's known as people who use technology to partake in their own healthcare and manage the responsibility of their own health and wellness. So that's what we know as the definition of ePatient today. They can participate and follow along in their health journey and can keep up to date with their health information just by tracking it themselves or having devices that track it for them. But they're just really engaged, they're searching, and yeah. So we also talked about the use of the internet and how drastically it has changed from the very first year to now, and how in 2021 we're estimated over 6.3 billion internet users. So for e-patients, there's going to be a lot more. There's going to be a rise of e-patients because people are getting more interactive on the internet, where they are finding their medical information and suggestions and ideas. And then we also talked about the global snapshot of around the world, the digital snapshot, and it just talked about the progress of how far we have come in the United States with our total population, our mobile users, our social media users, and so on. And one point to make on the social media users, that can actually be a good place for people who want to reach out and find out if there's other people going through the similar illness or chronic illness as they are. A lot of people go to Facebook and they have like Facebook pages of people battling diabetes, or people battling stage 2 cancer or something like that. So they have these resources that you can use to go and talk to people who are going through the same thing. So that's another benefit of social media, like medically. We also talked about Google and how Google knows everything. So Google was created in 1998, and that really started getting ePatients engaged, really, because they're Googling their treatments, their conditions. If they have signs and symptoms, something, they're going to Google it and find out what they have. And so that really started the new generation of ePatients, because they wanted to know what was going on with their bodies. And we also talked about how a report from the Institute of Medicine, they talked about healthcare should be safe, effective, patient-centered, timely, efficient, and equitable. And then we also went on and talked about how the term e-health emerged, which describes the electronic communication information technology related to health information that is accessible online. So it's kind of similar to ePatient, but it's more of the information. Healthcare can be expensive, and uninsured and underinsured are avoiding expensive by managing their own healthcare by looking up ideas online and getting information from other people about who are going through similar issues, finding good treatments that work for them. So they're avoiding, the hospital visits, the doctor visits, just by being active in their own medical life. And we also talked about 23andMe and how people can now find out their genetic makeup, genetic information. And this was just an example to show you how fast like mobile technology and all this information is just being accessed and made today. And then we also talked about the 3 categories of digital healthcare consumers. So we have those who are well, and those are the searches related to prevention and wellness. Those who are newly diagnosed with an illness, and their searches are related to a sense of urgency to understand and manage their disease and their health status. And the last category was those who are chronically ill, and those searches are searching for resources, services, and support groups who they can reach out to and kind of ease their mind a little bit. And then lastly, we talked about quantified self, and that refers to a person invested in using tools and data to quantify and monitor daily experiences using personal metrics. So this is like your food journals, your exercise logs, and stuff like that. So there's a little overview of lesson 1. Thank you.